Hello, everyone. I'd like to welcome you again to the EAHAD Meet the Author series. My name is Paul McLaughlin. I am the past chair of the Physiotherapy Committee, and I'm really pleased today to have Claire Forde with us. In this interview session, Claire is a specialist occupational therapist who works at the Haemophilia Comprehensive Care Centre in Belfast, Northern Ireland. And today we're going to talk to Claire about the poster she presented at EAHAD in Milan earlier this year about sort of the occupational therapy service that she has essentially established in Belfast. So, welcome, Claire. Nice to see you here with us today. So, I suppose maybe my first question for you then would be for those people perhaps listening or watching, to give them a better understanding, could you give us an overview of what an occupational therapist is or does?
Yes, I can indeed. Thanks, Paul. Yes, it's quite a common question at times, but what we do, no matter what area you're working in. But basically, occupational therapy is looking at helping people participate in their everyday activities or occupations, things that are meaningful to them, despite their injury, illness, or condition. So the focus really for OT is on function, it's on independence, and it's actually on the patient's quality of life. I think perhaps in haemophilia care, it's really been about helping the patient live well with their condition, not just managing the symptoms that they have. So it can be overcoming a lot of different things. I can be looking at functional mobility at times. I can be looking at home safety, vocational support, or fatigue management, or at times environmental adaptation. So it is quite a broad range of areas because I guess OT in nature is looking at the physical and the psychosocial elements and the environmental elements that our patients are having difficulties with.
Mm. And it's quite a unique role that you're the only one in the UK we know of as a sort of having an occupational therapist full time in haemophilia care. So, how did the OT role start in the centre in Belfast? How long has it been established?
Okay, so the role came about, it was actually first established in 2019. That was the first dedicated OT post within the Belfast Haemophilia Centre. I came into post just shortly after that in 2020, which was actually during the COVID pandemic time. So it wasn't an ideal time to be starting a new post, but hey, we all managed. So yes, that's when I officially started within the team. I guess the role itself, it was an interesting one, how it evolved was really there was an increase of admissions, really, I think, of patients with haemophilia coming onto the wards, the haematology wards, where my core OT colleagues would have worked. So by the time they were realising, gosh, we have these patients that are being readmitted a lot and they clearly have a lot of functional difficulties. And I think that sort of sparked the need for, oh gosh, we see these patients on top of our general haematology caseload. And would there be benefit in us having a dedicated OT within that team, which was kind of unique concept at the time. But the OT lead at that time then went to Dr. Benson, who is the director of the haemophilia NI team and consultant, and he really could see the benefit of OT with a particular patient group. And he was really instrumental in supporting that and then going on to secure the funding, which is always the difficult part.
Yeah, I mean, it's fascinating. I think it's we've spoken before that I would be delighted if we were able to get funding for an OT within our service. I think it would be amazing. So your poster presentation at EAHAD in Milan was unique in that it was the only one really that it mentioned was the only one specifically about OT within a bleeding disorder service. And I would argue it remains unique that I've never seen anything similar at EAHAD or indeed any other haemophilia or bleeding disorders conference. So you did a service review. Can you tell us a little bit about sort of how the service review came about and what essentially were the main findings of that?
Yeah, so basically, it was a retrospective audit that I did. I reviewed, it was about 263 patient records, and it was conducted alongside a PPI project, which is a personal and public involvement project, and a service called the Belfast project as well. But in essence, it was all about reviewing clinical records. It was basically looking at how different diagnostic groups and age ranges affect the way we were delivering the haemophilia services. We wanted to understand how the OT role was developing in the area and reflect on what was working well and what wasn't. which is they're equally as important. And really, it was just looking for those insights from the audits to inform our future practice, to making sure that, because it is a unique and evolving service, that we were actually meeting the needs of the haemophilia patients. So it was a really good opportunity to take a step back and actually just to look. It was like 2019 to 2022 to take a step back and see, right, what actually am I doing with this patient group, and where am I most effectively used within that. And looking probably at the findings, Paul, of the audit itself, I think one of the key findings we noticed was that patients over 40 were really starting to experience more functional difficulties. While those kind of up until 40 in general, and I'm only generalising here, but were remaining really quite functionally well. So it's more as people were reaching, on the back of this audit, we're reaching more about 60 and above, that challenges became more evident, especially with mobility, functional mobility, managing stairs, their domestic chores at home. So it was really good in highlighting that for that particular age group. It was also interesting that a lot of the input with patients was with mild haemophilia A patients, which again, I had just assumed it would be more the severes. Obviously, our haemophilia A patient group is larger, but in general, they were actually availing of a lot more of the OT intervention at the time when I was doing the audit.
And it's interesting because, of course, one assumes sort of functional impairment and issues with mobility may come with older people who are older, but if, over 40 is not old, and certainly over 60 is, although it's older, it's certainly not into what we would call sort of older people's medicine or anything like that. And I think, do you think it's sort of identified this idea around this people aging with haemophilia or bleeding disorders, and actually this sort of accumulation of physical problems that an OT, what brings OT to that? What uniqueness does OT bring to that sort of cohort?
I think definitely when patients are starting to experience difficulties with all their personal care, with their domestic chores, with how they function within their own home environment, we're very key. I mean, it's lovely we have the opportunity to go out and see people in their home environments, to assess their home environments. There's been more sort of work of late around looking at falls prevention. And just environmental adaptations and how they can look at their home. I think it's probably as well for the patient as well to understand our role, and I think that it's something to try and help them maintain their independence at home. So it is looking at all the areas that they touch into, even within and looking in the whole area of aging with haemophilia, and even coming into that is isolation and people that are not engaging with their community sports around them. They don't have family, they don't have maybe a huge network of friends. Being able to help people see that that's actually part of their well-being, and that affects their overall health, which affects the work the doctors are doing, the physios, whatever, their compliance with treatment. It just affects their whole care. So it's been quite nice, and I think that's given me the opportunity. And sometimes people actually as well are more comfortable when you see them at home as opposed to seeing them on an acute ward in the hospital, which I guess we all are if you've ever been in, And like I said, it's just being able to build that bigger picture for colleagues as well when we're discussing patients. And we all are bringing different focuses to the overall patient care, which is really nice to be able to do that.
In the service during the audit, were there any sort of findings that were surprising to you? Things that you thought, oh, we weren't expecting that? Or was it all sort of
I'd say, there was nothing that was really surprising, but it was more just interesting. And I think, obviously, I was starting to see the trend, and generally people as they get older or frailer are encountering more difficulties. But I think I didn't anticipate sort of just that the patient group, the mild haemophilia A's, were also encountering a lot of this. So it sort of broadened my horizon there. And when I was looking at criteria then for reviewing patients, potentially the patients I thought I would be in weren't necessarily the ones then that I have now become more focused on. Whether they like that or not, I'm not sure. But and as well as that, I think when I initially started within OT, you were doing a blanket sort of, hi, I'm Claire, and knew with the team what OT did. And some people were nearly going, why would I need you? And I nearly wasn't one to sow seeds of, you will have difficulty with this as you go. It's interesting. There's a fine line there between patients, just appreciating that I could be there for seasons of their life. Do you know, sometimes it might be earlier than they anticipate, but it's not to say they will have all these other difficulties. But I think in general, it was being able to clarify that role as well
Mm. Do you
for
think
them.
the presence of an OT has changed the dynamics of the traditional haemophilia multidisciplinary team? Because as I say, there are not many teams that would
Yes.
have an occupational therapist as an integral part of the MDT.
Yeah. And I would certainly love more friends within the teams. I really would. Okay, I hope, yes, I've maybe added a more holistic perspective maybe to patient care. I think obviously the care is traditional in many ways. Look at the medical management. They're obviously physio kind of core members on our psychosocial friends, social work psychology as well. And hopefully it just has been able to add that wee different perspective and a fuller perspective, maybe looking at more about the independence and people's participation in activity and how that is seen as their overall well-being for the patient group. Um, Hopefully, maybe more of late, it's helped the team be maybe more proactive in looking at the aging patient and frailty, which is very topical. But
Mm.
hopefully it's been nice that I've been able maybe just to focus more on that at the moment because and by certainly no means saying that teams are very patient-centered in general and do look at the oral care, but you can only do so much as well. And if you have people in the teams that have that expertise, then that's wonderful that you can,
Yeah.
go, okay, that'd be brilliant if you can take that forward and look at that area. So that one person isn't trying to do a wee bit of everything and always referring maybe out into community services, which are tricky to access and can take a
Mhm.
long time. Like I would obviously still be connecting in with my community OT colleagues for to follow through on adaptations and different things that come patients' way. But I think what I bring is sort of just the unique insight of knowing exactly what OT can do for them. And when I'm making
Mhm.
referrals to these different agencies, that I can be more specific in what they can do. And to be fair, it's like all of us, we have triage systems, we have prioritizing, and sometimes when we're referring people on, and if we don't really know the ins and outs of the patient and the detail, we can't refer in such an informed manner. So that helps at the other end when the patient's being triaged and prioritized.
Yeah, having that knowledge of that kind of system within the community services is advantageous in making better referrals, knowing that the
Yes,
referral is more likely to be accepted. Um,
yes,
and as you say,
absolutely.
that sort of that holistic approach, the fact that you bring in, you acknowledge the hemophilia stuff, but very much within the psychosocial and the sort of how someone lives
Yeah,
in their own
yeah,
environment, own community, which is great. Yeah, I mean, and I think really, if you're sort of seeing that as this bright future for bleeding disorder services, where we have people who will live into older age, but unfortunately, there will be a group that will live into older age with physical impairments associated with the bleeding disorders. How realistic then do you think it is for other services to engage with occupational therapy services? Is that as in, would you have any suggestions of how people could find an OT or sort of engage? How would they engage occupational therapists in their hospitals, for example, to help them with a patient?
yeah. I think obviously it can be tricky and it's hard accessing OTs at times as well. I think it depends whether they're in the acute admission or in the community. But certainly, like I said, the way we have it here, they can work alongside the hematology team. So some of our OTs on wards will see patients, and I'm sure other areas can experience that as well. Um, I think obviously we're unique in that I'm dedicated to the team, and I think for maybe areas that it's just not on the horizon or it's not going to be an imminent thing that's going to happen. I think it still would be good to make contact with the OT team, whether it's in the community or in the hospital setting, so that they can input. Maybe even if you're doing educational sessions with patients, so you're maybe not having the direct contact with OT, but at least they're involved in the general education of our patients. Or maybe if there's areas where you can invite them in to help when you're looking at reorganizing a service or looking forward. So it's not a reactive thing, but they can be part of planning, especially potentially maybe in the for aging patients and frailty within your service.
Mm.
But I know it's difficult, and it's difficult if it's not a dedicated post, because obviously it's not their priority, and you're sort of tapping into existing ward services and existing things. But I think, like I said, at the very least, the patient education maybe is a big area of where at least I know there would have been maybe an OT from rheumatology that could have come in and spoke to things about fatigue management and different areas as well. So it's maybe they're trying to tap in to your
Yeah.
colleagues.
I think it's really looking at how future-proofing haemophilia services. You talk about fatigue management, and you sort of know if you look at the issue potentially of frailty in people, haemophilia, pain management, sort of, as you say, fall safety at home, enabling as much independence at home as possible. It really has such a good synergy with physiotherapy within haemophilia as well, and actually how what a service merging the two with occupational physiotherapy
Yeah.
and social work and could manage with, sort of
Yeah.
keeping people well in the community for as long as possible.
Absolutely. It's kind of like that paradigm where we all kind of overlap a bit, but we all
Mm,
complement each other. And I think that's a real benefit of working with a team and being able to get the feedback of the different areas everyone's been working on, and that you're not going in blind so to certain scenarios, and you can be better informed then. And
yeah,
um,
no, it's brilliant. So that would be all my questions for you. I would like to thank you very much for your time. And I would really invite people to look at Claire's poster, which we will put a copy on the website alongside this interview. Also, Claire will be presenting at the multidisciplinary session at EAHAD next year in Dublin. So I would welcome everybody to come to that session and ask her some questions afterwards about occupational therapy as well. If you're interested, I'm sure she'd be delighted. So thank you very much again, Claire, for your time. Much appreciated.